Did you know that essential fatty acids from the diet is vital for your brain health, skin health, hormonal health, and immune health? In this video, you'll learn the different types of fats and how different omega fatty acids help you regulate inflammation and protect your organs. This is Dr. Peter Khan. I'm a board-certified chiropractic neurologist and board-certified in integrative medicine. Let me show you how to master your health. Now, there's a lot of confusion and myth around dietary fat. Fat was first demonized as the cause of heart disease from 1960s to the 2000s. Then fat was idolized with a ketogenic diet craze since the 2010s. Now, despite all the information out there about fats, many people still struggle with symptoms and poor health as a result of improper dietary fatty acid intake. Now, this is because most people lump fat into a single category of nutrient. But in reality, there are many different types of fats that play different roles in your health. So it's important for you to know that fat doesn't just contribute to calories and energy. They play essential and critical roles in your brain health, skin health, hormonal health, immune health, mucosal membrane health, and so on. Now, let's start with understanding how fat nutrients from dietary intake is broken down and turned into different types of fatty acids that helps us. So it starts with dietary fat intake. And a fat molecule is made of glycerol compound and 3 fatty acids. And these fatty acids, once you ingest it, so here you see a happy person eating an avocado. Yes, that's an avocado. And once the fat gets broken down, it gets broken down into its individual fatty acids. Now, these fatty acids can reconstitute in the bloodstream, and they can form triglycerides, cholesterol, and phospholipid. The phospholipid can be used as part of your phospholipid bilayer for your cell membrane. So it's very important for your cell membrane to stay flexible so you can absorb nutrient. And then the cholesterol is used as a starting material for your steroid hormones, such as your sex hormones, your adrenal hormones, as well as helping in inflammation process. The triglyceride can be used for energy or storage. Now, these different type of fats, they all serve different function. Primarily, fat is a very important nutrient. It's not only a source of energy, it also is part of a structure of your brain cells. So your brain has a myelin sheath, and that myelin sheath helps you to conduct nerve electrical activity faster. So it's very important for you to have good amount of fat intake to form that myelin sheath for good brain function. Your brain is also 70% structural fat, so it needs a lot of fat just to form its own structure and for its own function. So without fat nutrient, your brain function is not going to be optimal. The fat is also very important for insulation, to keep you warm, give you a little reserve in energy. In case of starvation, then you have some reserves so you can last a little bit longer. The fat for females is very important as well if they're also maintaining hormone function. Females with too little fat in their body can have amenorrhea, where they don't have a menstrual period because your body's perceiving that you don't have enough fat or energy reserves for you to maintain pregnancy to have a baby. Fat is also very important for immune function, as we're going to discuss in just a little bit, involving the eicosanoids, which are signaling molecules that help you to trigger inflammation or trigger resolution in inflammation. Fats are also very important for energy, as I said, for storage. So it's very important for you to get proper fatty intake. As with all nutrition, it's about just right? Too much is not good, too little is not good. Now, back to our fatty acid discussion, there's different type of fats. There's saturated fat, monounsaturated fat, and polyunsaturated fat. So what does it mean when we say saturated fat? Saturated with what? Well, saturated with fatty acids, these different fatty acids. So when the molecule of fat are saturated with fatty acids, that means all the fatty acids are connected by a single bond. There are no double bonds. That's when it's called a saturated fatty acid. And a saturated fatty acid tend to have the physical property of being solid at room temperature. Think butter. Okay? Then we have the monounsaturated fatty acid. So unsaturated means there's an area on this molecule that does not have a fatty acid there. So it's not saturated with fatty acid. So instead of a single bond, it has a double bond there. And there's only one double bond, so it's called monounsaturated. And then you have the polyunsaturated, which means that there are multiple double bonds, multiple locations on this fat molecule that doesn't have fatty acid. Instead, they're replaced with a double bond. The MUFAs and PUFAs, monounsaturated and polyunsaturated fatty acid, they tend to be liquid in room temperature. Think flaxseed oil, olive oil. Now, we also have different type of omega fatty acids, right? These fatty acids can be in different type of omega configuration. The omega just means for chemists to identify the location of the double bond on that chemical structure. Now, all you need to know, besides these chemical jargons, is that different omega fatty acids serve different functions in the body. And so therefore, it can impact you from the dietary fat that you intake, can impact your health and your symptoms and how good you're going to feel. Okay? So let's learn about omega-9s. Omega-9s is going to make up your MUFAs, or monounsaturated fatty acid. So again, they're going to be typically liquid in room temperature. Think olive oil. Now, omega-9s are what's called non-essential fatty acid. So for fatty acid, there are essential and non-essential. Essential fatty acids means your body cannot synthesize it and you must get it from the diet. Non-essential fatty acid means that these are fatty acids that your body can actually make on its own based on other fats that you take. So you don't have to get it from the diet, but you can get it from the diet as well. And it's helpful to get some in the diet. So the omega-9 is a non-essential fatty acid that's in the monounsaturated fatty acid category. And there are many different types of omega-9s. But in general, what we're going to see is that these omega-9 fatty acids from acetyl-CoA is going to be converted to palmitic acid, then stearic acid, then converts to oleic acid. And the oleic acid is found in abundance in olive oil. And this partly kind of explains the health benefit of olive oil. Now, omega-9s tend to have an anti-inflammatory effect. It can reduce TNF-alpha and interleukin-1 beta. These are cytokines that trigger inflammation. So if we can dampen that, then you get less inflammation. It can also reduce oxidative stress, which means to reduce the effect of oxidation, almost act as an antioxidant. And oxidation causes cellular damage and cellular aging. So it's protective against that. The omega-9s also decrease neutrophil migration. Neutrophil are specific types of white blood cell that are there to kill infections or to eat up cellular debris. And when you have a lot of neutrophil migrating to an area, you're going to trigger a lot of inflammation. So the omega-9s can dampen that process so you don't get as inflamed. The omega-9s can also increase macrophage debris clearance. Macrophages are these big immune cells that are like Pac-Man that eat up cellular debris. They're like the trash pickup collectors. And so when you have a lot of debris in your body, whether it's from infections that you just killed off or you twisted an ankle, you have damaged tissue floating around, this is all very inflammatory. So for the macrophage to clear out that debris is naturally anti-inflammatory, and omega-9s help to do that. And lastly, omega-9s may reduce free fatty acid floating around in the blood. Free fatty acid that's floating around in the blood, that's not esterified, means that they're able to be deposited easier. Okay, so this can cause more cardiovascular risk. So omega-9s has health benefits. And then omega-3 is part of your PUFA family, the polyunsaturated fatty acid. So you know it's a liquid because it's a PUFA. And there's two different types of polyunsaturated fatty acid, omega-3 and omega-6. Okay, they're both PUFAs, and there's two specific fatty acids that are essential within the omega-3 family or omega-6 family. In omega-3 family, the essential fatty acid, which means that your body cannot make on its own, you must get it from the diet, is omega-3 in the form of alpha-linolenic acid, or ALA. Alpha-linolenic acid is essential, which means you can only get it from the diet and you cannot synthesize it on its own. Sources of alpha-linolenic acid from the diet includes nuts, such as walnuts, flaxseed, chia seed, hemp seeds. Okay? Now, this alpha-linolenic acid, once you consume it, can be converted to EPA and DHA. Now, EPA and DHA are the fatty acids, omega-3 fatty acids that are found in fish oil. Now, your body can convert alpha-linolenic acid to EPA, DHA. So these are not essential fatty acids, which means your body can produce it on its own. However, that conversion from this to this is very slow. So if you eat tons of plant sources of omega-3, that conversion is so slow, you're not going to get enough EPA, DHA from plant source omega-3 alone. This is why I recommend taking a fish oil supplement or increase the consumption of fish or taking cod liver oil, something that'll give you additional sources of EPA DHA. Why is that important? Because EPA DHA gets converted to resolvins, protectants, and mucins. These are specialized fat compounds that help to resolve inflammation. As the name implies, resolvins, which means resolve inflammation. Protectants, which literally means protecting you. Protecting you against what? Protecting the brain and protecting the heart against inflammation. So these are very important compounds that help you to resolve inflammation, kind of pump the brake and stop the inflammation process. So they're naturally anti-inflammatory. And how they do that is, again, by increasing macrophage debris clearance, which means get the macrophages, the Pac-Man, to come and clear out cellular debris, which is anti-inflammatory in and of itself. It also reduces nuclear factor kappa B, which is a signal, a protein signal in your DNA that triggers inflammation. All the inflammation stimuli in the environment all trickle down eventually to this NF-kappa B, and that basically makes a final button that says, we're going to get inflamed because we're under attack. So if we can dampen that NF-kappa B, we can dampen the ambient inflammatory response. It also, omega-3 can decrease endothelial activation. What does that mean? Endothelial means the inside of your blood vessel. That's where heart disease and blood vessel plaques happen, atherosclerosis happen. So if we can decrease endothelial activation of inflammation, then we can protect your blood vessel and protect your heart. So hence, omega-3 fatty acid can protect the brain, heart, liver, and blood vessels because of the anti-inflammatory effect. Now keep in mind that the fish oil will contain both EPA and DHA in varying ratio, depends on your source of fish oil. The EPA tend to have a more systemic anti-inflammatory effect, kind of help the heart and the rest of the body, while the DHA is the primary omega-3 fatty acid that's found in your brain. In fact, your brain will actually use the DHA as part of its cell membrane. Okay? So in case of neuroinflammation from a concussion or brain injury or any type of brain inflammation, your brain will literally take the DHA from the cell membrane, degrade the cell membrane to get the DHA out to help to dampen inflammation in the brain in the case of brain injury. That's just how important this is. Okay, so omega-3 has a lot of health benefit, and there are many different types of omega-3s. I'm listing the primary ones. Next, we have the omega-6, which is also a PUFA, polyunsaturated fatty acid. It is specifically the linoleic acid is an essential fatty acid, which means that you must consume it from a diet. If you don't have it from a diet, your body cannot make it on its own. There are other omega-6s that's not listed here, but this one is an essential fatty acid that I'm highlighting. Okay? Now, that omega-6 linoleic acid, the food sources include corn oil, peanut oil, safflower oil, sunflower oil, okay? And it includes some nuts and seeds. So for example, walnut here has both omega-3s and omega-6s in varying ratios. Okay? Now, you can see that omega-6, when you consume it, first gets converted to arachidonic acid. This arachidonic acid then can go 3 different pathways. It can go into the COX enzyme pathway, the LOX enzyme, which is a leukotriene pathway, and the cytochrome P450 pathway. Now, what's important to see here is that along this pathway, there's certain places where there are certain drugs that can block some of these pathways. For example, corticosteroids can block this phospholipase A2 enzyme that's here that converts these linoleic acid into arachidonic acid. So if we can block it right here, then it doesn't go downstream where inflammation is the end result. So that's how corticosteroids help you to block inflammation. But guess what? Your body also produces its own corticosteroids, and that's called cortisol. That's your body's natural anti-inflammatory. So your body literally has a natural pharmacy of its own, and cortisol, it's its own corticosteroids that has its anti-inflammatory effect. And you see here the conversion of arachidonic acid to this COX compound can be blocked by aspirin or non-steroidal anti-inflammatories such as ibuprofen. It blocks these COX enzymes, COX-2 enzymes. So then downstream you have less of this prostaglandin and thromboxane formation, therefore less inflammation. And that's how these aspirins and ibuprofen and Avils work. Okay? Now, the COX enzyme can convert into thromboxane, which has a function of homeostasis, which means to decrease blood flow so you don't bleed out, kind of help you with clotting. And then the prostaglandin is a major eicosanoid compound. Eicosanoids are signaling molecules, such as prostaglandins, that help you to trigger inflammation or to stop inflammation. Okay? So this eicosanoid pathway is what we're describing here, and aspirin and Advil specifically manipulate that eicosanoid pathway to have an anti-inflammatory effect, because the prostaglandins is going to have a pro-inflammatory effect. It promotes inflammation. Now, people might think inflammation is bad. No, inflammation is not bad. Inflammation is necessary when you have an injury, right? So promoting inflammation when you have an injury is what you want. Promoting inflammation when you have an infection, that's what you want. It's just that you're not supposed to be injured for the rest of your life. You're not supposed to have an infection for the rest of your life. You're not supposed to have inflammation that doesn't shut off, right? It has to have a gas pedal where you speed things up, pro-inflammation, and you have to have a brake pedal to say, hey, we're done with this, let's rebuild, anti-inflammatory. So pro-inflammatory is not necessarily bad, but when it's excessive, then that can start to create problems. So it can increase inflammation. This pro-inflammatory pathway increases pain. So when you're injured, your body gives you pain, so you know you're injured, so you don't move the injured area too much, so you allow the body to heal by giving you pain signals. It can also induce fever through a central nervous system response. So this is why when you take aspirin or NSAIDs, it can help to reduce fever as well, because the prostaglandin has a central nervous system effect in raising fever. Okay? Then we have the LOX pathway, which is the leukotriene pathway. The leukotriene can increase vascular permeability, which means you make your blood vessel more permeable. When the blood vessel is more permeable, then more white blood cell can come to the area, so we can bring on more inflammatory response to kill the bad guys that might be infecting the area. So this is a pro-inflammatory response. It can also increase neutrophil and eosinophil recruitment. Remember neutrophil? We talked about neutrophil earlier. This is a type of white blood cell right here that are out there to kill bacteria and pathogens. So if we increase neutrophil recruitment, we're going to have a lot more white blood cell coming to the area looking for things to kill, which ramp up the inflammatory response. That's all well and good when you have an infection. It's not so good if this lasts longer than it should. It also increases eosinophil recruitment. Eosinophil is a type of white blood cell that triggers allergic responses, triggers allergy. So when you increase these type of responses, you're going to get more blood flow, more swelling, more edema, more inflammation, more pain, more allergies. Another thing is that these leukotrienes are oftentimes expressed in the lung, and so that can induce asthma. And you notice the montelukast, which is a medication, an asthma medication, block the leukotriene pathway. And that's how the montelukast helps with asthma. And then the LOX enzyme also has a lipoxin pathway. The lipoxin pathway actually has an anti-inflammatory effect. So not all of these omega-6s has a negative effect. It's more complicated than that. It's not so black and white. Okay, so we don't want to say omega-6 is just bad. As I said earlier, inflammation is necessary sometimes, right? You just want it to stop when it's done. So a LOX pathway has an anti-inflammatory pathway where it also produces resolvin and protectins to help to pump the brakes on the inflammation. Okay? And lastly, the cytochrome P450 enzyme. This is more in the liver. This can convert the arachidonic acid to this EET molecule, which has a role in vasodilation, angiogenesis, which means like to make more blood vessels, and plays a role in inflammation. Now, it's important to know that there's a ratio, there's a balance between omega-3 and omega-6, and even omega-9. But what's the most well-studied is the ratio between the omega-3 and omega-6. Because you see the overall trend, the overall property of omega-3 is anti-inflammatory, and the property of omega-6 is overall pro-inflammatory. So if your dietary intake is way too much of the omega-6 fatty acid and not enough of the omega-3 fatty acid, then the ratio of the 6 to the 3 can be so high that you're promoting inflammation. So a normal, healthy omega-6 to omega-3 ratio should be about 2-to-1 or a 4-to-1 ratio, right? So that means for every 2 omega-6, you have one omega-3, or every one omega-3, you have 2 to 4 omega-6s. That's about the right balance. But guess what? The standard American diet, the omega-3 to omega-6 ratio is more like 1 to 20. So for every one omega-3 that standard American diet consumes, they're consuming 20 omega-6 fatty acids. So it's way off balance, and this dietary contribution is what drives this inflammatory pathway for many people. Eating a standardized American diet, a Western diet, that's full of these corn oil, peanut oil, safflower oil, sunflower oil that are in chips and donuts and these processed food. And this is very, very pro-inflammatory because the diet is driving the physiology toward this pro-inflammatory pathway. Now you know the difference between saturated and unsaturated fats and the importance of omega-3, 6, and 9 fatty acids in keeping you healthy. Now in the next video, you'll learn the causes of essential fatty acid deficiency and discover the symptoms so you can identify if you have a deficiency or imbalance. Now if you found this video helpful, please hit the like button so I will continue to make more useful videos like this. And please subscribe to my channel if you have not already done so you get notified when I release new videos. God bless you and see you in the next video.